A very warm welcome to everyone joining us here today for the 47th AfriScience Network Webinar. And for those who may be joining us for the first time, the AfriScience Network is a platform committed to fostering scientific engagement, knowledge sharing, and meaningful conversations around issues that matter to Africa and beyond. Through sessions like this, the network creates an opportunity for experts, researchers, professionals, and members of the wider community to come together, learn from one another, and explore ideas that can contribute to a healthier and more informed society. And today we have yet another important conversation ahead of us. Health is often shaped not only by the things we do, but also by the things we fail to do. And sometimes the choices we make in our everyday lives may have consequences that we don't immediately see. And this is why today's topic is particularly relevant. It invites us to look more closely at our behaviors, our inactions, and the role nutrition plays in our health. My name is Khair, and I'm delighted to be your moderator for today's session.
The AfriScience Network is dedicated to fostering innovative and multidisciplinary scientific research and development across Africa by uniting academia and industry scholars with shared objectives. This thriving community of nearly 10,000 members engages through multiple WhatsApp platforms to enhance research quality, drive innovation, strengthen collaborations, and provide opportunities for knowledge sharing and capacity building. Given the challenges faced by African scientists and the transformative potential of research and development on the continent's socio-economic progress, our mission is more critical than ever. With the right support and resources, the AfriScience Network aims to shape Africa's research landscape and establish the continent as a global hub for scientific excellence.
So the topic for today's webinar is behavioral change antecedents to blood clots formation, our actions, inactions, and nutrition perspectives. We are privileged to have with us today an accomplished scholar and professional, Professor Oyediran Emmanuel Oyewole, who will be taking us through this important subject. Before we proceed with the presentation, I will be reading the citation of a distinguished speaker, so I'd love everyone to pay attention. Professor Oyediran Emmanuel Oyewole is a public health, nutrition, and health promotion professor in the Department of Health Promotion and Education, Faculty of Public Health, College of Medicine, University of Ibadan, Nigeria. He holds graduate and postgraduate degrees in human nutrition and public health, with a bias in health promotion and education, all in the Faculty of Public Health, College of Medicine, University of Ibadan, Nigeria. Professor Oyewole was trained as a dietitian at the University College Hospital Ibadan, Oyo State, Nigeria, from 1993 to 1994. He became a Nigerian registered dietitian in 2007 and practiced briefly in some private healthcare facilities before venturing into academics. He obtained a Ph.D. degree in public health nutrition in 2007, and he became a professor in 2020 in the Department of Health Promotion and Education, Faculty of Public Health, College of Medicine, University of Ibadan, Nigeria. He holds certificates in many areas of health disciplines, including clinical trials, monitoring and evaluation of health disciplines, gender mainstreaming, HIV counseling techniques, training on health intervention programs and innovative techniques in research methodology, among many other skill-based training. Professor Oyewole was a former head of the Department of Health Promotion and Education in the year 2018 to 2020 and twice the sub-dean of the Faculty of Public Health, College of Medicine, University of Ibadan, Nigeria in the year 2014, 2015, and 2017. His areas of research focus include public health nutrition education and training, diet therapy, reproductive health, gender issues in public health, especially from a male perspective. His other areas of expertise include community organization and development of public health intervention programs with a focus of non-communicable diseases and preventive care. He has published more than 90 research articles and co-authored 3 books in his areas of research expertise. He gives health talks on behavioral change for health promotion to communities and corporate organizations. Professor Oyewole has won individual and joint research grant awards, including the Bill and Melinda Gates. He has collaborated with other seasoned scholars in multidisciplinary research, including TED Fund Grant, Senate Grant of the University of Ibadan, and with the private sectors, including Nestle Nigeria PLC, Resolve to Save Lives, Links USA, and Friesland Campina Nigeria, Netherlands. Professor Oyewole won a postdoctoral fellowship to VAAL University of Technology at the South Africa in 2007, and in 2020 he won NIH award to participate in the 2010 NIH Training Institution on engaging communities to improve global health, which in turn reduce disease burden through collaborative approaches in Johannesburg, South Africa. In 2013, he was invited to participate in the 12th International Graduate Course on the production and use of food composition data in nutrition at the HOF van Wageningen in the Netherlands. Professor Oyewole was one of the facilitators of the Consortium for Advanced Research Training in Africa 2014 to 2021. In 2023, he was appointed by Friesland Campina as a member of expert panel to deliberate on child growth, developmental and infection domain in Nigeria. He has worked as a consultant to states, federal government, non-governmental organizations, World Bank, and other international agencies. Professor Oyewole is the current editor-in-chief of Journal of Institute for Dietetics in Nigeria. He is a family man who enjoys a very quiet and private life, and he's a lover of nature. He detests deceit in all its isotopes, and he believes that all life's problems have expiry dates. That's really amazing. So thank you very much, Professor Oyewole. We are delighted to have you with us today, and we look forward to learning from your wealth of knowledge and experience. Without further ado, Professor, the floor is yours and over to you. Thank you.
Good morning,
Welcome.
everybody, and let
Good
me
morning, sir.
start by appreciating the organizers of this laudable program that is there to provide information that will help people to better their health and to help even the younger ones to know what they need to do to contribute, even to make life better for many individuals all over the world. I will be speaking in the next 45 minutes thereabout on the topic that says behavioral change antecedent to blood clot formation, our actions, inactions, and the nutrition perspectives. From this title, it is seen that I'm trying to make a combination of 2 fields, the fields of health promotion with the field of human nutrition. which I've seen to be a kind of very strong synergy to promote people's health. So I'll try to appreciate all the organizers of the AfriScience Network Webinar series. I don't want to start mentioning names because there are so many of them, but I just have to mention maybe Professor Shueto and the coordinator, Dr. Aminu Shitu, and others that are working behind the scene to make this possible. So I welcome everybody on board, and I'm sure if you listen attentively, we'll go home with one or two things that will make our health to be better, especially in an area that is not so popular, but it is very, very important for everyone to have one or two information regarding this so that we can actually protect ourselves accordingly. The overview of this presentation includes giving us the preamble on what the entire presentation is all about. Then I will talk briefly on the background to this presentation. Then we'll look into those behavioral change antecedents and how they influence our health and how we can use that to prevent health issues. And also we'll go into knowing more about awareness of blood clot formation and associated health risk. We will look into knowledge of blood clot formation and possible health challenges. Then we'll look into the issue of perception of blood clot formation, susceptibility, and individual health risk. Then which is the main meat of this particular presentation, looking at the issues of our actions and inactions and how these are related to blood clot formation, the one we refer to as thrombosis and embolism, which I'll be explaining in the course of the work. Then, of course, we'll talk briefly about the medical screening that is available to discover our blood clot status, to know whether we are actually a candidate that may develop blood clot, very soon. So we look into what we need to do to know what our status is all about. Then we'll talk briefly about the preventive strategies against formation of blood clot. Then we'll talk about the nutrition perspectives to prevention of blood clot formation. Then we'll conclude and I make recommendations, then with the references that are already there. What exactly is the goal of this presentation? In other words, why are we spending our Saturday morning, to listen to this particular lecture? Basically, is to educate, ourselves on behavioral change antecedent to blood clot formation. That is the one we refer to as thrombus and embolus, which I'll be explaining in the course of the presentation, with consideration for our actions, inactions, and the nutrition perspective. So generally, we are just here to educate ourselves, to know more about what exactly is blood clot and why should we actually spend time learning more about it in the presentation of today. So I just urge every one of us to listen so that we can ask questions at the end of this presentation. Let me start with the one I refer to as the guiding statement, because somebody somewhere may be wondering why is a health promoter in health promotion becoming a little bit engrossed with the issue of a blood clot. And that makes me to give a little bit of information on what exactly do we do as a health promoter. In health promotion and education department, we hold on to the fact that nearly all disease conditions are linked to our behaviors, either directly or indirectly, using the established theories and models for explanation. In other words, the behavior people exhibit, whether in the negative or in the positive, there are theories and models that we can use to know why people are acting the way they act. Next, promotion and education department, we hold on to the fact that nearly all disease conditions are linked to our behaviors, either directly or indirectly, using established theories and models for the explanation. You will get to know more about this in the course of this presentation, to know that what people do or what they fail to do can actually be determined by some models and theories, which we actually do in health promotion and education. And I also say that we focus mainly on the process of empowering people to increase control over and to improve people's health through adoption of behaviors that promote health. What am I trying to say here? In health promotion, we believe that when people are actually exposed to some basic information and training, they may actually spend more time, lesser time going to the hospital to go and ask for what they need to do to better their health. Because for everybody, there are things that they can do on their own to promote their health. And I'll be looking into some of these issues today as far as blood clot formation is concerned. So this presentation will focus mainly on prevention of formation of blood clots, thrombosis and thrombus and embolus, using the principles of health promotion approaches to behavior change. The information to be delivered is not about treatment of thromboembolism, but it is all about how to prevent it using changes in our behavior, which we'll be talking about in the course of this presentation. Anyone who has been diagnosed with thrombosis, I will advise, should go and seek medical care from a qualified healthcare provider. I think we can move to the next slide. So my starting poser, and I want everybody to listen today and see where they are presently. I'm starting by asking a very silent question. Have you gone for any med check this year as an individual? Have you? We are in July already. We are in the end of July already. Have you taken your step to know how your body system is working? The next one. If you have done that, which one did you go for? In other words, if you have gone for med screening, which one did you go for? And I will also expand on that to say what happened thereafter when the result was or were given to you. In other words, after you've gone for the med check, you are given the result. What did you do after? Did you ponder on what you might have been doing wrongly that have predisposed you to the condition and initiate a change in behavior? Or will you just start using drugs alone? Or you combine using drug and changing your behavior? What we'll find out in health promotion in most cases is that when people go for tests, let's assume that try and conduct a med check on your cholesterol level, and the result you have shows that your cholesterol level is high. What will you do? For most people, the next thing they would want to do is to start using drug. And we in health promotion are beginning to see that can actually create more problem, because most times the problem we are having, we can just change something in our behavior, and without using any drug, we can come back to normal. Many people are treating diabetes or hypertension today because they fail to understand that there are things they can change in their behavior that can actually prevent them or cure or manage that diabetes or hypertension, and without using any drug, they will still live their life the way they should. But most times, the moment the lab result comes out, the next thing is for us to start using drug. Unfortunately, drugs to cure hypertension, diabetes, and all this, it is better not to start with them at all. The moment you initiate taking these drugs, you may actually become a candidate forever. Meanwhile, that issue can actually be resolved if you look at what are the things you've been doing wrongly and try to make a change from that. You may not use any drug, but with the behavior change, you come back to normal. And that's what we are trying to promote in our department, to say it is not every time you have your lab result that just jump into using drug. The first step will have been, what exactly are you doing in the wrong way that has pushed your cholesterol or your blood sugar to be higher? And what are the things you need to manage well so that you won't start with the drug? I will talk more about this as we get along in this presentation. Next slide. So essential med checks for screening. This is just for general information. In other words, if you are thinking about what medical screening can you go for, I have the list here. But if you look at this slide, there are 2 items that I have in red. These are the ones that are actually very important to this presentation today. The one we refer to as D-dimer test, and the other one, dental care check, to discover infected gums. I know somebody will be wondering, what concerns dental check with the issue of blood clot? Just hold on. I will expose us today as we get along. But just know these 2, that I will be talking more about D-dimer test, and I will also be talking about dental care, so that we can actually address the issue of blood clot formation. Next slide. So there is a reason for my interest in this particular health issue, the one we refer to as blood clot. And I will want us to just listen and enjoy why I've developed a passion to address this public health epidemic that many of us are not really aware of. Recently, I lost a friend's brother who was presented with severe coughing episode and was taken to a private clinic for treatment. Unfortunately, he was not improving with the treatment being received and had to be referred to the University College Hospital, where he was diagnosed with blood clot in his lungs, the one we refer to as pulmonary embolism. He was in the process of removing or dissolving the blood clot, when a strike action was declared, and all the patients on admission were asked to continue treatment somewhere else. Of course, he was evacuated to another private hospital where we eventually lost him. Losing this man gave me a little bit of sadness, because it's like, oh, if they have known a bit of clot formation, maybe the man would not have actually had that problem at all. Unfortunately, he had the problem, but because of the issue that we have in Nigeria presently, where the hospital can go on strike and patient, no matter whatever, will be asked to go, we lost this man. So the honest truth is, if people are aware of what can cause blood to clot and create problem, we can take actions on our own to prevent this. And this is the main essence of this presentation today, to say as an individual, we are all susceptible to having blood clots, but how can we prevent it? And what can we do to ensure that we don't have it at all? And this will be, presented in the course of this webinar program. I start with the preamble now. Many times our health is highly dependent on what we do or fail to do in terms of our behaviors. What we all know is that there are things that we do or we fail to do that have the potential of predisposing us to either good health or the otherwise. And today we'll be looking at some of these issues. What are the things that we do or we fail to do that can make our blood to clot? And what are the things we need to stop doing so that we don't have this kind of challenge? But we want to know more about other things related to blood clot. And today we are looking at the antecedent to behavior change in health promotion are the foundational psychological, social, and environmental conditions that prompt individuals to alter health compromising habits and adopt the one that is health enhancing. Positive behavior change antecedents are related to the actions we need to take to prevent ill health. And we know for sure that formation of blood clots, the one we refer to as thrombosis and embolism, which is the main focus of this lecture series presentation, is highly influenced by our actions and inactions. Next slide. So let me break this presentation into 4 phases. The first one, we'll be looking at the behavioral change antecedent of actions and inactions. Then we'll look at the information on how our blood clots, forming the thrombus and embolus, how are they forming our system and how do they affect our health. Then we'll look at the application of component of behavior change antecedents to prevent formation of blood clot. And lastly, we'll be looking at, in terms of nutrition, what are those things that we need to include or to add to our diet that can help our blood not to clot easily. So I will be providing some information along that line. So let's start with the understanding behavior change antecedents of actions and inactions. And I go straight by looking at, when we say behavioral change antecedent, what exactly are we talking about? In behavioral science, an antecedent is any event or environment or circumstance that occurs immediately before a behavior change occurs. In other words, if we want to prevent blood from clotting to create problem for us, what are the things we need to start doing? That is what I can summarily say constitute our behavioral change antecedent. So it acts as a trigger or cue, signaling that a specific action will likely result in certain consequences. In other words, if we fail to do things, definitely some ill actions or ill health may follow. The understanding the antecedent is the best way to predict, prevent, or intentionally modify unwanted actions that can lead to ill health. Today, we'll be looking at what are the actions and inactions that can actually push us to have thrombosis. And that's the meat of this presentation. So the antecedent to behavior change include, are we aware of what blood clot formation is all about? Knowledge. How much do we know about it? Perception. Do we see it as something that is terrible? Attitude. How do we dispose to this particular information of blood clot? And of course, the practice. What are the things we need to start doing now? And what are the things we should not do again to ensure that our blood doesn't clot and give us problem that is not really what we look at for. So prevention of blood clot formation, which may lead to deep vein thrombosis. These are big grammar, but I'll try to break it down. You will get to know what deep vein thrombosis is all about in the course of the lecture, and the one we refer to as pulmonary embolism. This requires actions that will improve blood flow, remove the blockage in the blood vessel, prevent blood vessels damage, and neutralize hypercoagulability. What am I trying to say here? When we talk about blood clot, people may be thinking that, are we saying our blood should not clot? No. What this lecture is all about is not about the one that is positive, because when you have a cut on your skin, you don't pray that the blood will continue to gush out. That blood should stop flowing out, and there will be a kind of formation of thing that will seal the blood from flowing out. But the one we are talking about is when you have that blood debris that now enters into the blood vessels and now prevent the blood from flowing to where it's supposed to flow to. That is the one that this lecture is actually focusing on. And we will soon see the damage that this thing has done over the years to many people that are not aware of its existence at all. So let's look at the components of behavior change, which I've already mentioned. When we are talking about behavior change, there are 5 key things that affect what we do or what we fail to do. The first one is awareness. The next one is knowledge, our perception, attitude, and practice. And I put a cursor there to say having the enabling environment will also assist in changing behavior in addition to these fundamentals. What I'm trying to say here is, when we are talking about changing behavior, there are 5 fundamentals that we need to pass through. We need to be aware, we need to have the knowledge, we need to have a positive perception, our attitude towards it should be positive, and we'll be able to do practice what is right. But even when you have these 5, there should also be an enabling environment, something that will encourage you to be able to take necessary action, which I will be explaining in the course of this presentation. The next one, behavioral change spectrum towards prevention of blood clot formation. the one we refer to as thrombosis. As I've said, the first stage under this behavioral change is awareness, and this has to do with this is referred to as the first step to positive behavior or change, which is awareness. It involves cognizance of and familiarity with any health issue through hearing or observation. That is, when somebody talks to you about something, then the person is actually creating awareness through the right channel. One of them is what I'm doing presently. I'm about to provide more information on blood clot formation, and I believe awareness is going to be created through this presentation. We can also use the one we refer to as IEC material, which includes poster, to ensure that we create awareness on issues that has to do with blood clot formation and the associated health challenges. Then, in health promotion, as I've said earlier, we use theories and models to explain why people will do something or they will fail to do something. And for the awareness, there is a theory that has been proposed by Prochaska and Clemente, which has to do with, or which is called trans-theoretical model. This particular model is used to educate people more on the impact of awareness before they would take any stage or any action regarding their health. So this presentation may be a means of creating awareness on the risk associated with formation of blood clot to some listeners for the first time, because I believe many people may not have actually had the opportunity of knowing what blood clot is all about, can prevent them from having that particular health problem. The next one here is perception. In fact, this has a very big domain. In other words, if you are aware of a health problem and the causes, and you have knowledge about it, the next thing is, what is your perception about that? So perception, using the concept of health belief model, the one that was developed by Rosenstock et al. In 1988, tells us that perception of people on blood clot formation is considered under the domains of when somebody mentions to you blood clot, do you perceive yourself as being susceptible? In other words, as somebody listening to this presentation this morning, do you consider yourself as somebody who is susceptible to have blood clot? The second one, do you have any perception that it is very severe, it's something that can kill? And do you also perceive that if you take action, there are benefits that you will actually get by taking some actions that can prevent you from having the problem? Then if you want to take this action, what are the barriers? In other words, if you want to stop your blood from developing clots, what are the barriers? What are these that can prevent you from taking this action? Then we look at the cues, something like the prompt or the signals that can make the preventive actions against formation of blood clots and also self-efficacy. In other words, by the time I'm ending this particular lectures, I will expose us to some practices. But the question there will be, do you have that unction or the power to do those things that I will be presenting to us, so that it will not be a candidate of blood clot? So for perception, we look at 5 domains. 6 domains. We look at the perceived susceptibility, perceived severity, perceived benefit, perceived barriers, then cue to action, and self-efficacy. In health promotion, we know that before anybody can make a change in terms of their behavior to go for health promoting behavior, these levels of perception will be worked on for that individual to know what he or she needs to do. Next one. So the next one is attitude. If you are following, I've talked about awareness, I've talked about knowledge, I've talked about perception. Now the next one is attitude. Attitude is talking about our disposition towards changing to good health behaviors that can prevent formation of blood clot. I will give information on some of the things that can actually predispose us to having this blood clot today. But the honest truth is, what will be our attitude to this information that will be released? Is this that we will take it as something that is serious, and we need to leave those things that we do that can actually jeopardize our life by making us to have blood clots in our system. And in health promotion, there is also a theory that we use to educate people more about how to change their attitude. That one is called theory of planned behavior, which was developed by Adzen in 1985. And lastly, which is the one of the most important stages of behavior change, is practice, which has to do with the actions that we take to promote health by preventing all lifestyles, including unhealthy body postures that can lead to formation of blood clot. Today, you will see that even the way we sit down sometimes can actually predispose us to have blood clot. So we will look into the practices that we engage in presently that can actually push us to have clots in our blood. And this particular practice has actually been provided also under the theory of a transtheoretical model that was developed by Prochaska and Clemente in 1983. If you remember the first reference I made on awareness, these same two individuals actually work on this particular model, and they are the model that we are found to be very useful in ensuring that people's behavior are changed in a better way so that their health can actually become better. So let's look at the empirical information on the prevalence, formation of blood clots, the thrombus and embolus, the morbidity and mortality rates in Nigeria and Africa. The honest truth is that this is a ravaging problem, but it is a bit silent that many people are not aware about the dangers associated with it. Now, let's listen to empirical information that we have on the prevalence and the formation of blood clots, in many people, especially some of my audience listening to me across the globe now. So, how does blood clot lead to thrombosis? That is a very big question. In other words, this blood clot we are talking about, how does it lead to trouble or problem? Blood clots naturally form inside the blood vessels. In other words, as I've said, if you have a cut now and the blood is coming out, within 5 minutes or so, the skin is sealed. That is a positive one. And body has the natural way of doing that to ensure that we don't lose much blood. So that is expected. However, in homeostasis, the body shows its ability to stop injured blood vessels from bleeding through the formation of clot. That is the natural positive way so that we won't lose blood. But let's now look into the issue of thrombosis. Thrombosis occurs when blood clots uncontrollably inside and in intact blood vessels. In other words, you don't have a cut, you don't have any laceration on your skin, but inside the blood vessels, I mean those pipes that carries the blood from one place to another, when we start having the clot forming inside, that is where problem that we are talking about this morning actually starts from. So thrombosis occurs when blood clot uncontrollably inside an intact blood vessel through a process. Thrombosis occurs when blood clot uncontrollably inside an intact blood vessel through a process driven by 3 main triggers. In other words, for blood clot to form, there are 3 main triggers. The first one, the vessel wall damage. In other words, the pipe that is carrying the blood to every part of our body, that vessel is damaged. The wall that is surrounding it, the wall that covers it inside is damaged, and that forms some debris. Then there is slow blood flow. In other words, blood is not flowing the way it is because it is very thick. Many of us don't know when our blood is thick, but I will talk about that very shortly. And changes in blood composition. Actually, this definition was given by NIAID in 2027. And all these 3 have both biological and behavioral antecedents. Clot can, however, form without an injury if blood flows too slowly, in other words, during long flight or prolonged bed rest, or if cholesterol plaques burst inside the arteries forming embolus. There are things I want us to know here that sometimes, especially for those of us that engage in long flight, maybe you are on a 7-hour or 8-hour trip on the plane, and you are just seated for that long hours, you are cutting formation of blood clot. And I will talk more about this in the course of the lecture. I was trying to say, if you're on a long flight and we are just seated there for long hours, it is a process that will encourage blood clot to form. And I will talk more about this in in some of the slides we are going to look into. And also, if we have some plaques come from mainly cholesterol, debris from microorganisms, whatever, that might have entered into our blood cell, into our blood vessels, and allow or prevent the blood to flow the way it should. Hypertension has been regarded globally as the silent killer. In other words, nearly everybody knows or must have heard about hypertension. But the honest truth is, when we talk about blood clot or thrombosis, many people don't know much about it. And that is the reason why it is a very silent epidemic. And it has been found out that the moment there is a blood clot, blood flow to certain organs can be truncated. And when there is a blood clot, it can be fatal in minutes. In other words, hypertension may not kill within a minute, but blood clot can do that, which shows that it is even deadlier compared to hypertension that is so popular. So this makes it very important for all of us to know what exactly can we do so that we don't be a victim of blood clot formation. So this can happen, I'm talking about thrombosis now. This can happen when a clot breaks off and travels through the bloodstream and prevent blood from flowing effectively. It can develop in veins or arteries, affecting blood flow and potentially leading to serious health consequences. When blood clot occurs in the vein with some fat deposit, bacteria and other debris, it is called venous thromboembolism, the one we refer to as VTE. So subsequently, I may be using the word VTE. VTE means venous thromboembolism. In other words, when there is a clot or bacterial debris in the veins, we may have what we refer to as venous thromboembolism. And the one that is formed inside the artery are called arterial thrombosis. A blood clot in one of the major veins in the body, that is the vena cava. I don't want to go too much into biology now. Is called deep vein thrombosis, DVT. In other words, for those people that have a bit of information about blood clot formation, they might have heard about this name that is called deep vein thrombosis, which I'll be talking about. So there are two main things that I want us to learn from this, because I'll be using them subsequently: VTE and DVT. VT is the one that is formed in the veins, and when we have the one that is formed in the deep vein, we refer to that as deep vein thrombosis. DVT is actually formed in the legs. You will see the picture as we get along. Next slide. So let's look at the country-specific data on thrombolysis. In other words, has this thing gone so viral? Is it everywhere? Statistics on morbidity and mortality from blood clot, that is venous thromboembolism, in Africa indicates a significant burden with high mortality rates in specific patient group, although a comprehensive continent-wide data are limited. Data are often fragmented, derived from smaller single-center studies or specific patient population across different countries. VTE risk is high among hospitalized patients, with one study showing a prevalence of VTE risk at 50.4%, in other words, more than half, in sub-Saharan Africa. We can break this down to 62.3% for medical patients and 43.8% for surgical patients. This was reviewed by Kingui in 2014. In other words, when we talk about the risk, hospitalized patients have the higher risk of having thromboembolism problem, because they are in bed, they are not moving that much. And that actually is one of the risk factors to the formation of blood clot, which shows that if somebody lies down in the same position for long hours, the possibility of blood to clot is very high. And this has been demonstrated in this work published by Kingui in 2014. We also look into what to find out in South Africa. In South Africa, over 200,000 people suffer from DVT yearly, and an estimated 20,000 die each year from this condition. In other words, this DVT has actually been so ravaging. Imagine losing 20,000 people every year because of this problem, which was actually published by Oyewole et al. In 2016. In one study in Togo, in-hospital mortality rate for pulmonary embolism, the one that happened in the chest, blood clot, that is blood clot in the lungs, was 8.7%. This was published by Pesinaba et al. In 2025. In Nigeria, in-hospital-based study mortality rate during a VTE episode was 10%. Adeoye et al. Published this one in 2020. Postmortem studies in Africa population show a VTE prevalence of 2.9 to 5.4, indicating that many cases are undiagnosed before death. In fact, Shotumbi et al. In 2026 did the study in UCH, and they were able to discover that nearly all the people that died, 5.4% of them actually died because of VTE. And that means these people died because they were not even aware that they had this problem until they were rushed to the hospital. So the essence of this presentation today is for us to become aware and know what to do so that we don't have this particular health challenge. Prevalence and mortality trends of VTE in Nigeria. So let's look at what studies have found out in Nigeria. Studies indicate that up to 50% of patients admitted to Nigeria hospitals are at the risk of developing thrombosis. Ezigbo et al. In 2022, a published article related to that. Then pulmonary embolism mortality rate among affected medical patients in Nigeria could range from 40% to 69.5%. Okeke et al. In 2024 published an article on this. An evaluation of postmortem data in Nigeria revealed a VT prevalence of 2.9 with a high incidence in male when compared to female. The ratio is 2.6 to ratio 1. And Shotumbi et al. Actually found out that this particular problem had been found out after postmortem, that it is becoming more common among male than female. Maybe people that are in the field of hematology and co may actually give us the reason for this gender difference or gender disparity. Now, as I've said at the beginning, how do we know whether we are candidates or we have the potential of developing thrombosis? Just one single thing. Thrombosis, that is blood clot in blood vessels, is screened for using a test we refer to as D-dimer blood test. If we go to any laboratory today and ask for this particular test, it is a test that will tell you whether your blood is becoming too thick, because the moment your blood is becoming too thick, that means the tendency of forming clots is very high. And that makes this particular test to be a preventive step to prevent developing of thrombosis. In other words, after listening to this presentation, if you have never done this test before, I'm just recommending it to you as a health promoter that we go and check how thick our blood is. And from there, we will know what we need to do, which I'll be presenting in the later part of this presentation. So if the result is positive, in other words, if you check, if your D-dimer result is showing that it is positive, the healthcare professional will follow up with you, to conduct other investigation to visualize where the blockage may actually be, and they check for where the blood clot is in the vessels and look for what they need to do to make things better for you. So where exactly do we have the blood clot in our body? I've mentioned some, but I'm just giving a summary here. We have the one we call venous thrombosis. This is where when a blood clot forms in the vein. Then we have the arterial thrombosis. This is when a blood clot form in an artery. We have the superficial thrombophlebitis. This is when the blood clot develops in the vein that is just under our skin. Then we have the DVT, which is abnormal clot form in a large, deep vein, typically in an arm or our leg. In other words, this particular thrombosis forms either in our arms or in our leg. We'll get to know more in the course of this presentation. Then we have the embolus, the one we refer to as thromboembolus. This is when the clot breaks off and joins with plaque and other materials, including bacteria, then travels through blood vessels. In other words, it's a kind of combination of the blood clots and other debris to create a kind of thromboembolus. Thromboembolus is a combination of two things. The thrombo is from the blood clot, the embolus is from the fat deposit and other bacterial material that may be in the blood vessels. And when they combine together, they have the tendency of blocking the flow of the blood to body organs. Then I'm trying to show some pictures here to show where the deep vein thrombosis are. You can see the leg, look at that square that shows the formation of the thrombus. And I'm trying to also show how the healthy vein looks like and how they put together to create problems that will now result into blood clots, and eventually when you have the thromboembosis, another combination of both the fat deposit and the blood clot, and ending up forming thrombo and embolus together. So I'm not sure whether this picture is clear, but what this picture is saying is just the summary of what I just presented. In other words, the location where you have these clots, where they can easily form and what they can easily result to. The one that forms in the upper part of the body are the tendency, the one we call pulmonary embolism. In other words, that one can actually lead to stroke formation because it can block the supply of blood to the brain, and that can result into things that can kill within few minutes. The one we refer to as heart attack or stroke. The one that forms in the leg can actually travel into the lungs, and when that happens, you will see the patient coughing seriously, which is what killed a friend's brother that I started the journey of the presentation with. So let's look at the severity of blood clot formation. Blood clot may be more common in the lower legs, but they can also occur in other parts of the body. A blood clot in a deep vein of the leg or the pelvis and sometimes hand does not usually cause heart attack or stroke unless there is another underlying special health condition. See this actually published in 2025. However, a blood clot in an artery in the heart or brain, which is called arterial thrombosis, can cause heart attack or stroke. This was also published by CDC in 2025. Blood clot can travel to the lungs from the legs and cause a pulmonary embolism, which I've just mentioned. All these have their peculiar symptoms and could be life-threatening. So, severity of blood clot formation. Blood clot in the brain. Blood clot that forms either in the chamber of the heart or within the carotid artery in the neck have the potential to travel to the brain and cause a stroke. Unlike most of other signs of blood clots, there may not be any pain with stroke, but there may be a kind of slight headache. This is just to distinguish with what happened to the clot that forms in the brain. Then blood clot in the abdomen. In other words, it is also possible that the clot forms in the abdomen, the one we refer to as mesenteric venous thrombosis. When a blood clot forms in one of the major veins that drain blood from the intestine, it is called mesenteric venous thrombosis. I will explain more about this in the next slide. Sometimes individuals are more at risk of mesenteric venous thrombosis, the one that forms around the stomach. And this includes anyone with a condition that causes swelling of the tissues surrounding the vein, such as appendicitis, cancer, diverticulosis, and pancreatitis, or acute swelling of the pancreas. In other words, anybody that has this has the tendency of having clot being formed. So use of some birth control pills and estrogen medication can also increase the risk of having this type of clot. In other words, anybody that is on birth control pills or having estrogen medication needs to talk with the doctor who is managing them about the potential of them having blood clot and what the doctor needs to do so that this will not happen. The symptoms of a clot in the abdomen may include abdominal pain, bloating, and vomiting. So application of behavioral change antecedent to prevention of formation of clot. This is where we started with. How do we apply awareness, knowledge, perception, attitude, and practice to the issue of prevention of blood clot formation? So awareness of the formation of blood clot. Blood clots are a common but often overlooked health concern that deserve greater awareness. As I've said, many people know little or nothing about blood clot. So symptoms of a blood clot vary depending on the location, but may include pain, swelling, redness, and tenderness, and sometimes resembling a muscle cramps. In other words, sometimes when we feel like we are having a pain in our legs, the one we refer to as muscle cramps, it may be a subtle sign that the blood is not really flowing the way it should, and the signal to the brain is that there is pain. Once you notice something that is like leg cramps or muscle cramps, I would suggest that we visit our healthcare center to know exactly why we are having that challenge. They are most common in the legs or in the hip region of the body. Being aware and having the knowledge of how to support healthy circulation by preventing blood flow clot formation is very key to protecting our blood vessels, health, and overall well-being. In other words, the first thing we need to know is to be aware of the formation of this particular clot, which many people don't. So the first lesson that we all have today is that we are now becoming aware of something that is called blood clot and how it can influence our health. Let's look at the knowledge now. I think it's still awareness I'll talk about. Okay. So I'm still talking about awareness, please. So men are at higher risk. I've already said that, but I'm just emphasizing it. Men are at higher risk of getting both the first time and recurring blood clot than women. The reason for that, we have not really come across much information about that. But presently, it has been documented that men have this particular problem than women. Anyone suspecting a blood clot should seek immediate medical attention for diagnosis and treatment to prevent complication and untimely death. Whether one spends long hours sitting, travel often, or have a family history of vein disease, our lifestyle and behavioral changes can make a remarkable difference in preventing blood clot formation and save lives. Now we talk about knowledge. Many people with DVT have no symptoms at all. The following are the most common signs or symptoms of DVT that occurs in the affected leg or arm. 1, there may be swelling, there may be pain or tenderness, the leg may be warmed or the arm may be warmed, there may be redness or discoloration. In other words, when you see something like the color is changing on the skin of the legs or on the arm, you may need to go and find out what exactly is happening. Note, any of these signs or symptoms may require seeking medical help as soon as possible. It is possible to have a pulmonary embolism without any symptoms of a DVT. Signs of symptoms of pulmonary embolism can include, in other words, when we have pulmonary embolism, the one that occurs in the lungs. What are the things the person will observe? the person may not be able to breathe well, the one we refer to as difficult breathing, that may be faster than normal or irregular heartbeat. You know that when you check your heartbeat, you will say that it is irregular. There can be chest pain or discomfort, which usually worsen with deep breath or coughing. Cough or coughing up blood. You know, when it gets to advanced stage, the person can be coughing blood. Then very low blood pressure, lightheadedness, and or fainting. In other words, these are the things that we see when somebody is having pulmonary embolism. The first one we talk about is deep vein thromboembolism. So that means we are talking about two. We talk about the knowledge of DVT, the knowledge of pulmonary embolism, which occurs usually in the lung. Any of these signs or symptoms may require seeking medical help as soon as possible. Then severe fractures increase the risk of blood clot formation, and this include, in other words, what are the things that we need to know as knowledge that can predispose us to have blood clot? These are the factors. The first one, whoever is sitting down for too long period, more than 1 hour, you are actually causing formation of blood clot. When there is poor circulation can be caused by so many things. For example, if you put on a very tight cloth, or as a man or even as a woman, when you put on your belt, it's so tight, you may actually be creating problem for yourself. Or sometimes we wear shoes that is not really our size, but because the shoe is good, we want to force our leg inside, and it is actually bruising the leg. That may be things that can influence poor circulation. Then whoever is smoking does not allow blood to flow easily, because it contains some chemicals that can kill those things that will enhance your blood to flow easily, especially all the antioxidant vitamins. Then dehydration is about how much water do you drink daily. I will talk maybe in the next 2 or 3 slides on the quantity of water you need to take. Then obesity, whoever is having very large frame has the tendency of having blood clot. Pregnancy has been found to lead people to have a blood clot, and that is the reason why when they attend antenatal clinic, they will be able to monitor them and encourage them on what they need to do so that they won't form clot. Then some family planning drugs, as I've said earlier, some family planning drugs have been found to predispose some women to have clot. So whoever is on family planning drugs should talk to their healthcare provider so that they will be able to monitor them and ensure that they don't have clot. Then some post-surgery, it has been documented that anybody that has undergone surgery has the potential of developing blood clot. So vein problems such as varicose vein, including the varicocele, and chronic venous insufficiency can also raise the risk, because blood does not flow as easily back to the heart. In other words, there is something we refer to as varicose vein. It happens mainly on the leg. You will see it on the leg, but it also has been found to appear in some in the private part of some men, as you will see in the next picture. You can see the leg here. You can see those things that looks like thread on the legs. These are varicose veins. Anybody that is having this is actually showing the tendency of having blood clot. And you will see the private part that is being shown here. Sorry for this kind of picture, but just to elucidate what I'm trying to say. This particular individual may not see this as any danger, but whoever has this in the private part is already a candidate that may actually end up having blood clot circulating in the system. And there is an unpopular source of blood clot formation, and I want us to listen very well, because this can happen to anybody. Knowledge of unpopular cause of blood clot formation. In other words, it is an area that many people have not really put in consideration as where blood clot can actually enter into our blood vessels. Poor dental care leading to gum disease and cavities has been found to be one of the unrecognized risk factors to stroke from clot. In other words, it doesn't even stop there. It can actually kill by allowing the blood clot to block the blood flow to the brain, which can lead to stroke. And how does it happen? Oral bacteria multiply rapidly by feeding on the food debris in between the teeth and those attached to the surface of the teeth, especially sugary and sticky chocolatey material. Beyond this, most times when we take our dinner, we go to sleep without brushing or without using any mouthwash. What I'm trying to say here is oral care has been found as one of the ways to prevent blood clot formation that can lead to stroke. And you can see from the picture, if you have a gum disease, is a sure way or sure sign that you may end up having stroke through blood clot formation that can enter into the system. So it's a lesson that we need to treat our gum. You need to treat, our dental care very well. I said at the beginning, one of the tests that we need to go for regularly, one of them is oral care. To see if you have any gum disease, they can help us to cure that. I'll be a little bit faster now so that I'm not caught up. Practices. In other words, what are the actions that we need to take that can prevent us from having, blood clot? We shouldn't be wearing clothes that is so tight. We should be wearing clothes that is loose a little bit, and the socks and stockings that are not too tight. We should be raising our legs up to about 15 centimeters above the heart from time to time, so that we don't, prevent blood to flow easily. Then we should engage in exercise that is prescribed by healthcare practitioner. It is not all exercises that we can do on our own. We need to consult professionals to teach us what they need to do. We should be standing up, at least one time within 1 hour. We don't need to sit long because it can actually create problem for us. Then for those people that are already having signs of clot, they can wear a sock that is referred to as compression socks. But there is something I need to put across that these compression socks cannot just be worn by yourself, because in America it has been banned, because it has to be monitored for anybody to wear it to prevent clot. Studies have shown that if you are not being taught on how to wear it and what they need to observe, you may actually be causing more problem wearing this particular sock. So it's not a socks that you can just go to market and start wearing on your own. It should be recommended, and your healthcare provider should monitor whether this one will actually help you or create more problem for you. So other things that we need to do: cooking salt. If you take too much salt in your diet, or you patronize all the food joints where they put so much salt, you are actually cutting formation of blood clot. If question is asked along this line, I will explain. Then prevent bumping your legs on anything that can cause damage or bruise. Avoid using pillow under the knees while sleeping or resting. Many people do this, but it's not a good thing to prevent blood clot formation. Then raise the bottom of the bed, if possible, by 10 to 15 centimeters to lift up the leg. Understanding this action and inaction will help people to take steps to prevent thrombosis naturally. Note, before taking any action to prevent thrombosis, perception of the benefit of the actions must be positive. In addition, the attitude, that the disposition to take this action towards prevention must also be positive. Then prevention of clot formation in the gum. I've just said that now. If you look at this, sometimes the brush we are using is like the one I'm showing in the picture. If your toothbrush is like this, I will tell you that please go and change, because this kind of toothbrush will not help you will not sanitize, will not help your dental care, and may actually be causing having problem in your mouth. And the other picture you are seeing there, it is advisable as one of the preventive measures that after you have eaten, use dental floss to remove food debris before you can now use any mouthwash, and ensure that the last thing you do before you sleep is to actually wash your mouth, so that you don't have anything that can create gum problem for you. And there are things I'm showing here which I believe we can learn from. The way we sit down that can actually predispose us to having problem with our formation. You can see the first person there. That is good sitting position. The two legs are on the floor. But if you look at the second one, that gentleman is crossing the leg. This is a very bad sitting position. Any sitting position that's along this line can actually predispose individuals to formation of blood clot, because you are actually blocking the flow of blood from the legs to other part of the body. And anybody that is in this habit of crossing the leg whenever they sit down, learn today that you are actually saying you are comfortable developing blood clot. And also, if you sleep and we put pillows beside our leg, as you have seen in the picture, may not be good enough. And sometimes we slouch on the cushion. Maybe we are tired, like the man you see in that picture is doing. Any sleeping position like this, it is also another way of creating no problem for ourselves. All these have been documented in research and they are published, as you can see, from the references there. The nutrition perspective. What are we talking about? What are the things that we need to incorporate into our diet that can also help us, allow our blood to flow easily? I won't be reading much. I will just go straight to the water. So let's see those things. So there are things that we can put in our diet that will really help us, to ensure that our blood flows very well. Next one. So if you have something like the fatty fish in your diet, fatty fish can be obtained from salmon, mackerel, sardine, and walnut. Then these are things that contains chemicals that will prevent inflammation and decrease the platelet aggregation, in other words, the blood cells coming together to create problem. Then spices, which is very important. Spices, the one we normally see everywhere, but we don't really know their importance. They are things, they contain chemicals that can make your blood to flow well. So if in your cooking, add turmeric, add ginger, use garlic, because they all contain very good compound that can prevent formation of blood clot. And many of us don't take this seriously. We don't normally, some may not even have taken it in the last 2 months. But I'm saying now, they are not too expensive. Your soup, your stew, whatever, you can add some of this, whatever. And there are even tea, which I think you should be very careful, because some of these tea, they've already added chemicals. Go for the natural ones and see the way you can benefit from there. And yes, this is still on the diet. I'll talk about hydration. Hydration is very important to prevent blood clot formation. If I say hydration, taking in fluid, especially water. For everybody, you will need minimum of 7 bottles of 75 cl water a day. And if you are taking sachet of pure water, you will need 8 minimum. In other words, you should go beyond that for your blood to flow very well. And if your BMI is equal to 30 or greater, you are also at risk, and you may need to do something about shedding some extra kilograms so that you can be in good water. I have some pictures here of some of these things that I've just said. We have ginger, we have turmeric, we have bitter cola that we see everywhere. We have cayenne. Cayenne is this very hot pepper that we see. They contains chemical, capsaicin, which can make your blood to flow very well. And you will know, if you use this pepper to cook vegetable, by the time you are eating that vegetable, you will see even the mucus coming out of your mucus that have been staying there for long coming out, because it has the tendency of breaking loose all the things that can actually create confusion in the blood in the blood vessel. So we recommend that we use cayenne pepper regularly, which is very common. The alligator pepper is there. Then cloves. These are things that you can get in our local market that we need to ensure that our blood flows easily. And there have been references on this to show the potential that they have in preventing our body, our blood from forming clots. So prevention of blood clot, that is through air promotion. As I've said, we are looking at the air promotion principle, and how we can use this. We can create awareness, campaign in the community on what people can do to prevent, thrombosis. We can go to workplaces to sensitize people. We can actually use peer education method. We can use an anti-education program for sensitization, which have been used before. If you remember Sonia Days and Onyeka Owenu program, if you love me, you wait for me, when they were using family planning promotion. We can also use the same thing to promote what people can do to prevent themselves from having blood clot. We can use entertainment to do that. We can use information, education, communication materials, which is posters and bills, to create awareness. We can use also survival led. In other words, somebody that have had clot, if you can get them, they can be a change agent that we can use to educate other people so that they will know what they need to do to prevent that. And of course, we can actually ask NHIS to ensure that they put this as part of the thing that people can do, when they subscribe to NHIS, so that they can go and check the blood flow in their system. So in conclusion, without any doubt, formation of clot is a silent killer with little attention. A good modification of healthy practices can assist to reduce the morbidity and mortality from this serious health challenge. A blood clot can happen to anyone, and nobody should allow it happen by taking all necessary actions to prevent its occurrence. And I'm recommending, as the concluding part, there is a need to create more awareness and request for a mandatory risk assessment upon hospital admission. In other words, as people have been admitted to the hospital, they need to check how thick is their blood and what they can do to ensure that by the time they are leaving the hospital, they are not going out with blood clot formation. There should be a better implementation of all known preventive strategies, including our practices regarding body postures, hydration, modification to include food spices, which have the potentials to curb the rising trend of VTE-related death globally. And as I round off, it cannot be overemphasized that the best way to promoting health of individuals is to attempt a multidisciplinary approach to health management, which is what is missing now. In other words, the healthcare professionals are working in silos. In other words, this is my field, I have to remain there. No. If you have been familiar with what happens in the developed world, everybody works together to save the life of the patient. And I think we need to get to that. In other words, nobody knows everything. We all will need to work together to ensure that our patients deserve the best. And that is what we should do to ensure that. As I close, I'm having these slogans, which I'm trying to promote now. Hashtag behavioral change first, not drugs. In other words, once you have been diagnosed to have a problem, unless it's an emergency, before you start taking any drug, ask yourself, what are you doing wrongly that might have predisposed you to this problem? And the moment you identify that behavior, the next thing is to change that behavior and see whether a change will come. And I'm sure if you follow that, you may not be an agent that will be using drugs forever by just changing your behavior. Hypertension, diabetes, they all have behavioral change component, which if we change, we may not subscribe to the issue of drugs. So I'm promoting this, and I'm also selling it to everybody to say, let's go viral with it. Hashtag behavioral change first, not drugs. So I think these are references that I have that will be shared maybe by the organizer. So I'm thanking everybody for listening globally, and I think we must have benefited or had one or two things that will benefit ourselves. I will be waiting for maybe clarification of questions in the next few hours. Thank you very much. Over to you.
Thank you very much, Professor, for that insightful and enlightening presentation. And I'm sure that we have all gained a lot from your wealth of knowledge and experience. And we will now move into our 20-minute question and answer session. This is an opportunity for participants to engage with our speaker, ask questions, and seek clarification on some of the issues raised during the presentation. And if you have a question, kindly use the raise hand feature, or you may type your question in the chat, and he will call on participants one at a time. As we have a limited amount of time, I would kindly ask everyone to keep their questions brief and focused, and we will try to accommodate as many participants as possible. We should have our first question, please. You can go ahead.
Good afternoon, House.
Good afternoon.
Thanks very much, sir, for that presentation. It was wonderful and highly enlightening. So my question is that can blood clots occur or happens in children of under 5, sir?
We have not seen any documented evidence. But since we know that sometimes what actually predisposes individuals to, adult individuals to blood clot, children can also have such. In other words, a child that is lying down for more than 10, 20 hours a day without being carried or whatever may have that challenge. But I've said, I have not come across any published work that shows that we have seen it in children. So it may have, it may not have. So I don't have evidence, on that. But what I know for sure is any child that is, having the challenges that can predispose individuals to having it may also have it. For example, if a child is not giving enough fluid or water, that may be a challenge for the blood flow of that little child. If a child has undergone surgery, there may also be the likelihood of blood clot being formed. But I'm just postulating on this. And maybe we need to look more to see if we will have cases of children having blood clot. But people in pediatrics, if they are, in the audience, they can actually provide maybe more information along that line. Thank you very much.
Thank you, sir.
Yeah. I think there is a question here. Does UCH lab machine have machine to purify blood? I didn't talk about purification of blood here. I talk about checking how thick your blood is. So the question that will have been maybe okay for me is, if you ask me whether you say I had the facility to do the D-dimer test. Present as I'm talking to you, I don't know. But I know there are other private laboratory out there where you can go and do the D-dimer test. And if I'm not mistaken, the one I did last, I think it was around 5,000, 6,000 naira for the test. So it's something that I actually encourage many people to go for if you have never done it before. Because it's the first stage to know whether your blood is too thick, because the moment the blood is too thick, that means it won't flow well. It won't flow the way it should. And that will be a very risk factor to, having blood clot. So thank you.
Hello, sir.
Yeah. Please go ahead.
Thank you very much for your presentation, sir. I'm very grateful because this is very, very important. I wouldn't have known the importance of this note that I had that it happened to a pregnant woman. And she just came home and she complained to her husband she was having pain. She was rushed to the hospital. Within some period of time, she ended in ICU. And they discovered that it was not the pregnancy, but that she was having triglycerides, fat in her blood.
Fat, yeah.
So she nearly died. But because she was in an advanced country, they have a machine to extract, they drain her blood, extract the fat out, and that's why she was able to survive.
We thank
thank you very much.
No, we thank God for that. Thank you.
Yes, sir.
Yeah.
Hello, sir. Good afternoon.
Good afternoon.
Thank you so much for educating us. In fact, I don't know if this can be shared, the slides. I don't know if it's possible. That's one. Then secondly, my question is on drinking of adequate quantity of water during the day. Yes, you did advise about 75 mils of bottled water daily, but I'm thinking that can we substitute beverage, maybe tea or any other beverage drink, or a health drink? Can that also be counted as part of the liquid intakes for the day? Thank you, sir.
Thank you very much. Water cannot be substituted with any drink, because the drink you are talking about already contains some materials or chemicals, which is not making it to be pure water again. What your body requires for blood to flow easily is water, not juice, not tea. Those ones you can take it at your leisure. But in terms of measuring the quantity of water that your body requires daily, I'm repeating, if you are taking 75 cl bottled water, you need minimum of 5 per day. If you are taking the water in sachet, you need minimum of 8 sachets per day. I need to emphasize, because sometimes people say they don't remember whether they've taken 4 or 5. And I'll normally tell them, can you make it an exercise? Maybe if you are at home or in your place of work, have that bottle and see the way you are draining it, and be sure that you have that enough water. There is something that I actually skipped because I was rushing. How do we drink water to make that water absorb to our body? Most time people gulp water, they don't sip it. And these are two different ways. If I take a bottle of water and I'm gulping, that sound will be coming like gum, gum, gum. That water may not be really absorbed into your system. And if you observe, the moment you gulp down water, in the next 10-20 minutes, you will want to go and pee. In other words, that water has not been absorbed into your system. It goes to your kidney and it goes out. How do we drink water? Water is best taken by sipping it. Sipping water means you put it in your mouth, allow it to stay there for a few seconds. While staying in your mouth, the saliva mixes with it. It is the mixture of that water and saliva that will allow your body to absorb. If you drink water by sipping, even if you finish 2 bottles, you may not go to the toilet immediately because your body cells will have absorbed that. And that is what I'm trying to preach here. So when you are taking water, you sip the water, not gulping. If you watch many people when they are taking water, they gulp water. And in gulping water, you take with the hair. And that's the some people, when you finish taking water, you start belching because hair has entered with it. That is the wrong way of taking water. Water should be sipped, not gulped. So if you are taking water, I will say thank you for that. But the process of taking water should also be considered. Don't gulp water, but sip the water. Thank you so much.
All right. Thank you for this presentation. I think I've gained a lot from it. So I wanted to ask this, but before I have a basic knowledge about this blood clotting before. I want to know whether it is I'm on the right track. Because when I was talking about the blood cells, platelets, thrombocytes, I was telling that when it helps in clotting, that is prevent bleeding when they have a little cut. Now that I see it on the other side now, from what we are discussing about blood clotting, that is even deadlier in the body, if you retain in the body and prevent flowing of blood. I want to know, I want to relate, is it, to clear the doubts, I want to know, is it the same thrombosis we are talking about, or the platelets we are talking about? Is it also beneficial as well, or is it only the problem that you are just telling us that is there, or the previous knowledge I had about thrombocytes is irrelevant at all? So I just want to know.
Okay, thank you very much, sir. I try to shift away from talking about fibrinogen and all those things that will prevent the blood from gushing out. That is the normal physiological way of ensuring that you don't lose blood that much. The one we presented today has to do with the clot that forms inside the blood vessels when you don't even have any cut. And when it travels with the blood, it has the tendency of blocking the blood flow to vital organs. That is the one that this lecture is all about. And I think at the beginning, I tried to give a kind of information about the two. That blood clotting has a positive side because the formation of fibrinogen and all those things that will prevent the blood from being lost in the body, it is okay. But when the clot now start forming in the blood vessels without having a cut, and the blood vessels has to carry it to wherever the blood is being pushed to, that is the one that this lecture is all about. And that is the one that I think many people are not aware of the danger that are associated. As I've said at the beginning, I developed interest in this presentation because I lost a friend's brother, because the person has pulmonary embolism, which wasn't discovered when he was admitted to a private hospital until he was brought to UCH. And unfortunately, when he was on admission, undergoing treatment, the hospital has to close down because of strike action. And they took him to a place where I'm sure they didn't have the wherewithal or the potential to remove the remaining clot, and he died. So the one that we actually consider in this presentation has to do with the one that forms in the blood vessels, not the one that is required to prevent blood from being lost when we have injuries. Thank you. So somebody is saying that what are the symptoms of blood clots that we can observe among individuals, and we can actually say that we are having blood clots which are internal in their system. Thank you. I think I've said it at the beginning. The starting point for us is for us to know whether our blood is too thick and is flowing the way it should. And there is a test for that already. If you go to any standard laboratory and you tell them you want to do D-dimer test, that is the test they will do to show to you that your blood is flowing well or is not flowing well. If it's not flowing well, the first thing is, what have you been doing wrongly? Do you start your day on alcohol? Do you take tea instead of water? Do you lie down for long hours? Do you sit down for long hours? Do you wear something that is too tight? So you need to ask yourself questions on what are the things you are doing wrongly that might have predisposed you to have this problem. And the moment you identify that, do away with those behaviors and start, and allow your system to change. What I don't normally subscribe to is, oh, you have discovered that you have blood clots, go and start taking drugs, which if you go to many private clinics, that is what they will do. They just recommend you to go and start taking warfarin. So warfarin is the blood thinner, and the moment you start using that, there are other issues. Because if you take warfarin for long, if you have a cut, then that clot may, if you have a cut on your body, the blood may not stop flowing because of that drug that you have used. So I don't normally encourage anybody to go for drug for, as I've said at the end, to say whenever you have a result of your test, the first thing you should ask yourself is, what behavior have I been subjecting myself to that has predisposed me to have this problem? Can I change this behavior? Then watch that maybe over time and see whether things will change. And surely things will change once that behavior is changed. But if you start by just using drug, you may be drug candidate for life. Go and ask people that are treating diabetes and hypertension. The moment you start using those drugs, you can't come out of it. Meanwhile, maybe you just need to change your behavior of what you are doing wrongly that is making your BP to rise. But you fail to do that and you just start using drugs, then you continue to contribute money to people that are selling drugs. So in summarizing your question, I've said that one step is knowing what you have, because when you have blood clots, you can be having pain. I said that in the presentation. You can be having pain in the leg, you can be having cramps, which you just think that I'm just feeling no, or you can be having numbness, something that will just show that something is wrong with your body. If you have any of these signs, go and check whether your blood is flowing well or not. And the moment you see that, you can make reference to this slide again, which I believe will be shared, on what are the actions you need to take instead of going for drugs. Thank you.
Good afternoon, sir.
Good afternoon.
Thank you so much for this presentation. In fact, this is the
You're
first time I'm hearing. Yeah. Early this month, I was actually rushed to the hospital. I wasn't breathing. I woke up, I couldn't breathe. So on getting to the hospital, they asked me several questions. We recently changed the chairs in my house. Not like the other chairs I lie down comfortably. So this one is not as comfortable as it used to be. So when they were asking me questions, I was like, okay, I noticed since we got this chair, I started having pains in my chest. I ignored. But until the other day, the morning I was rushed to the hospital. So they prescribed drugs and all that, and I came home. The doctor said nothing was actually wrong with me. So I just decided that this chair that is giving me this chest pain, I should stop lying on it. That was how that pain actually left. So I want to really thank you, because I think I have to go for this very test. Because I've observed that, like you said, that our behavior, that means this my sitting position actually affected my health. So I want to really thank you, sir. Thank you.
You're welcome. You're welcome, madam. Thank you.
Yes, sir.
Yes, my name is Emmanuel Oyewole. So I want to confirm, sir, what will you recommend? For instance, traveling for spending several hours, maybe via flight. Some people will try to travel to another location, spending more than a day on a flight, maybe connecting flight. Sometimes some people will be on a flight, maybe like 6 hours, 8 hours on a stretch, being on a single flight. They have to sit on the at the at the airline, then join another flight. Some people do that maybe like 3 times, 4 times, 6 times within a month, sometimes, sir. So I'm looking at what can we recommend probably to such individual or probably to the airline. Is there a way that probably the distance can be reduced so that we can prevent problem like this? That's one of my questions. Then also the second question is this: there are some people that probably they go to a facility, let's say for instance UCH now, to access care. Probably in the process of them accessing care, they need to stay more than for weeks, days. Sometimes they cannot lift up their legs, they cannot move. So what can we recommend as a public care professional to such individual so that it can prevent them from having this problem? Then lastly, sir, I understand from my basic physiology, from my background, there are some for the production of blood within the system, the bone marrow helps in the production of blood. Then there is an hormone produced by the kidney, that's the erythropoietin hormone, which also helps in the production of blood in the body system. So I want to know if there is any if this problem can prevent the production of blood by the bone marrow or by erythropoietin, which helps in the production of the blood in the system. Thank you, sir.
Yeah, thank you very much. I think you have 3 in 1 question. The first one has to do with if you're in long flight for 2, maybe 7, 8 hours, which I've already said may not be good for blood circulation. For those of people that usually travel longer, it is allowed for you to stand up or even walk around the house when you are traveling. It is only when the plane wants to enter into turbulence, whatever, they will ask everybody to sit down again. And for those people that are being exposed to that, you will see that after an hour or two, you see some people standing up, going to toilet, coming back. Some will even stand up and just hold on to the whatever, and the plane is still going. And that is what is recommended. The moment you are on any flight that's going to take more than 2-3 hours, you are allowed to unbelt yourself, stand up, if possible, walk to the toilet, walk back. And some people do that a lot when you are in the plane. And this is one of the things that you need to know when you are engaged in long traveling. And I think some airlines used to give this information before. I'm not sure where they are still doing it now. In other words, they will encourage people to stand up, especially the elderly ones, and even the younger ones now, to say, just stand up and move around so that you can stretch your leg. But let me also add to this. Even many of us in offices, sometimes we can sit down for 3 or 4 hours without standing up. It is the same thing. So the lesson here is when you sit down for 1 hour or so, even if you don't want to leave your table, stand up and continue with whatever you are doing. It helps to prevent, this thing we are talking about. On the second question about the plight of patient in the hospital, and I think you mentioned the name of a teaching hospital, which may not be good enough. There is a concept we are trying to sell all over the world now, and we are trying even to start, in Ibadan here. Concept of health promoting hospitals. In other words, I've moved around a little bit. I have not seen any hospital around us here that is actually health promoting hospital. Years ago, we are trying to sell that to our teaching hospital, but along the line, it was truncated. But it is an idea that we need to revive. Health promoting hospital is what we all need. A hospital where people will not get another problem while trying to solve one. There are so many things that are wrong with our clinics, with our many of our hospitals, which I think we in their promotion are trying to see how we can make all our hospitals, health promoting. If a patient comes into the hospital newly and they don't know where to go, they need information. All the hospitals we have supposed to have somebody at the gate to help a newly, invitee or somebody that just visit the hospital for the first time, so that they will know what to do, where they need to go, and they need to be treated, in a way that they have dignity. Not that we just be directing them to go and sit down there, to go and whatever, compounding the problem that they have. But that is not part of my presentation today, which maybe in some other time I may actually talk about the health promoting hospitals for all hospitals to know what they are supposed to be doing to help the patients that are coming to them. So presently, the way many of our hospitals are run, they are not well run the way they should. And I'll tell you, both the private and government hospitals are liable to this. I've seen it, not that I've read it, I've seen it. That if you want to come to, let's say, a very big teaching hospital, like the one I know so well, you need to know somebody and know somebody, or else you will get frustrated at the end of the day. And that's not really good enough. On the issue of blood cell formation, the lecture today is about what happens inside the blood vessels, in other words, that can lead to ill health. And we are talking about thrombosis. We are talking about thromboembolism, which are as a result of when you have blood debris, when you have bacteria, when you have plagues in the blood vessels, that they can come together and form embolus that cannot prevent the way the blood flows. So in terms of blood production, it is another thing entirely. And if maybe opportunity comes, I can go into how do we make our bone marrow to produce healthy blood cells? Because sometimes if you have disease of bone marrow, the quality of the bone of the blood cell being produced may not be what it should. Even lack of some vitamins can influence, terrible production of blood cells. But as I've said, I don't want to deviate from the lecture of today, which is on blood thrombosis, and I think I've presented on that. So if we need information regarding on how we can encourage or how we can improve blood cell formation, maybe I can be contacted, and I will give more information along that line. Thank you.
Sir, considering the prevalence of this health challenge and the mortality rate, can Ph.C. do they have facility to carry out blood tests to discover blood thrombosis? One. Then two, as a body, or how do we, as an enlightened person, how do we bring this information down to the grassroots? How do we enlighten and sensitize our people that do not have this information and they are suffering and they are dying from this health condition? Thank you, sir.
Yeah, thank you very much. Two questions in one. The first one was, do our PACs, do they have the facilities for these blood tests? I can't really say. But I know all teaching hospitals or secondary healthcare facilities supposed to have, because they have laboratory facilities. They're supposed to have, in other words, especially when a patient is being admitted, one of the things they're supposed to do is to see how their blood is flowing well. So if our hospitals don't have that presently, this will be one of the things we are going to recommend, to say, let our teaching hospitals, our secondary hospitals, venture into equipping their laboratory so that patients coming there can actually be assessed. Because sometimes the disease people are trying to treat are not really disease. It's because the blood is not flowing well. You get tired easily, you are feeling lethargic, you are not just feeling well. Before they start whatever, can we just check, is the blood flowing well? Does this person have clots? And this simple test can give us that answer. And with that, we can actually be giving best treatment to our patients. But if you have not been doing that, I would say it is something that we can look into. There are so many people that join this presentation, and I think we are all change agents now that can actually inform others about blood clot. You are also asking about, how do we take this information to the community? It's already at the community level. What you are doing this morning, this afternoon, is all about the community. We are all from one community or the others. If you that have listened to this lecture now can tell one or two people, and those other people are able to tell another 2 or 3 people, before you know it, many people become aware of what we call blood thrombosis, which before many are not. People know more about hypertension, they know more about diabetes, but the honest truth is many don't have any information about the word blood thrombosis. And as I've said in the presentation, it is another silent killer, even more than hypertension. So now that you have heard, don't keep the message to yourself. Share it. If you have a platform that you can, inform people about it. Oh, do you know of D-dimer test? Have you done it before? Go and check whether your blood is flowing well. You have done something, and that is what I think will be a take-home message for everybody who listen to this presentation. Let's make the news to go viral so that people that are not aware of what I refer to as blood D-dimer test, people can take it off. We go for a cholesterol, we go for liver function test and whatever. This one is even simpler. And I'll tell you, all body organs that are sick now may be as a result of the fact that the blood is so thick, the blood is not supplying those organs with nutrients that they require. So if you are now go to say you have liver problem, I will start using liver problem drugs. Meanwhile, what you have is, because your blood is thick, your blood is not flowing to the liver well, you are going to kill the patient. So I also say to everybody that is listening who are in the medical field, one of the things that you should encourage your patient to do is to know whether their blood is flowing well. Because any treatment you are giving, if the blood is not flowing well, forget it. Thank you so much.
Good afternoon, sir. Thank you so much for your very insightful lecture. My name is Ibukun. Sir,
Okay.
in the course of the presentation, you mentioned something about compression stockings and how, yes, they may offer benefit, but lately, new studies, especially in the US, have shown that they may not be as highly recommended, because I know of a center where a patient, if for any reason the patient is going to be on bed for a long period, compression stockings are given routinely to prevent DVT instead of placing on medication. So I don't know if you can shed more light in that area. What can prolonged use of compression stockings cause, sir? Thank you.
Thank you very much. If you listen carefully, I first mentioned that one of the ways to manage DVT is to recommend compression socks, which has been the global standard. But recently, studies in the US actually found that these socks was found to create some problems, to some patients. And when the evidence was so glaring, they actually made a pronouncement that in the US, it shouldn't be used again. But there is a contrary to that. If it is mandatory that the patient must wear that socks, then that patient must be monitored. Monitored means when the patient wears it, they continue to check how the blood is flowing. If the blood is flowing well, then that means the patient is doing well with the socks. But the moment they start noticing that the blood flow is being restricted, then they may not, allow that patient to, continue wearing the socks. The problem we have before was that when the patient has to wear the socks, nobody monitors them. They wear the socks and we just discharge them and they go home. But sometimes they'll be brought back in an emergency situation, which US has discovered that if the compression socks is recommended, the wearing of that sock should be under close monitoring to see whether it is actually helping the patient or is not helping. If it's helping the patient, then the patient continue to wear it. But if it is creating more problem, then the healthcare provider will actually have the patient not to wear the socks again. Thank you.
Good
All right.
afternoon, sir.
Thank you very much, Professor, for taking the time to respond to our questions and for sharing your knowledge and expertise with us today. Today's presentation has certainly given us a lot to think about, particularly the ways in which our everyday actions and our inactions and our nutritional choices can influence our health. And on behalf of the AfriScience Network team, I would like to express our sincere appreciation to you, Professor, for honoring our invitation and for such an insightful and engaging session. And to thank everyone who joined us today for your time, your attention, and your thoughtful participation. We truly appreciate your presence and contribution to today's discussion. And we encourage you all to stay connected to the AfriScience Network, visit our website, and subscribe to our YouTube channel to learn more about our activities and access recordings of our past webinars. Once again, thank you very much, Professor, and thank you to everyone who joined us. And it has been a pleasure moderating today's session. Until we meet again, have a wonderful day and stay safe out there. Thank you, everyone. Thank you.
Thank you very much. I wish all of us all the very best. Have a pleasant weekend.